Welcome to this educational video on toxic metal testing. My name is Dr. Peter Holzman. I'm a naturopath, medical practitioner and professional speaker based in Melbourne, Australia. In an ideal world, there would be one laboratory test that could accurately measure someone's level of toxic metals. In the real world, this is not possible. The reality is that urine, hair, and stool samples, as well as blood tests, are all quite different and the results may not correlate. The concentration of minerals and metals varies in different parts of the body, and ideally you need multiple tests to best interpret overall levels of minerals and toxic metals. I saw a 22-year-old man with chronic fatigue syndrome that had started after having glandular fever. So now you can see his hair tissue mineral analysis. On the left you've got the levels of nutritional or healthy metals, and on the right you can see the toxic elements, which are surprisingly low. So I often call this pattern too good to be true. The reality is that we live in a polluted environment. So unless someone is living on a tropical island with wonderful foods and zero stress, you are going to expect a moderate level of toxic metals. So in practice, low toxic metal levels on a hair test, especially the first hair test, can be low because of a number of reasons, including genetic mutations, lack of energy and healthy nutritional minerals for detoxification, or the relevant metal does not get excreted via hair. For example, thallium and silver do not show up in a hair test. Next, he had urine measures for metals and healthy minerals. And with this baseline test collected on waking, you can see that there's a little bit of nickel, but nothing else of significance. That evening, he took a handful of tablets and capsules, including the chelating chemical DMSA, and collected his urine overnight, and that sample was analysed. Once again, there's a moderate amount of nickel, but no significant levels of other toxic metals. A stool metal test gives a different picture, and you can see with the red arrows and red lines that there are a number of toxic metals that are significantly increased. The next patient to discuss is a 30-year-old lady with idiopathic thrombocytopenia. In other words, if you excuse the jargon, she's got very low platelets for no obvious reason. And here you can see her hair test results, and the copper is significantly high, and of greater concern, the mercury is well and truly off the chart. The high level of mercury is confirmed with a blood test, which is well and truly elevated. What's also interesting is the suggestion from the laboratory that people abstain from having any fish for at least 2 weeks, as mercury in fish can elevate the levels in the blood. And I think the important point to make is that toxic metals don't stay around in the blood for long. And within 28 days, you'll find that the majority of toxic metals have all been dumped into deeper tissues and organs within the body for relatively safekeeping. So what does this mean to you? Well, urine, hair, stool and blood samples measure different time frames and different compartments or parts of your body. There is no single test that can accurately measure your body's total burden of toxic metals. Energy, genetics, food choices and stress levels will influence test results. A holistic doctor familiar with these tests and your clinical history can best interpret your overall mineral and metal levels. Thank you for watching this educational video. You are welcome to ring reception on 03 9885 7766 for an appointment so that I can help get your health and energy back on track.